I started to get a little dizzy, seeing double vision. One of my eyes had really just dropped. Something was more wrong than just a little dizzy spell. So when he called stroke code, that was when it was really like getting hit right in between the eyes. That was not something that I had even considered.
Keith is a young, healthy guy with no stroke risk factors. So this was somewhat unusual and caught him and his family off guard.
This doesn't make sense. Keith is so healthy. He's done 10 Ironman races. He just ran 40 miles. He's healthy. Like, how could he possibly have a stroke?
It was test after test, and about the second day I was there, I remember one of the neurologists coming in saying that they had really no idea why I had what I had. At that point, most people had come to the conclusion that what I had was a TIA.
Transient ischemic attacks when someone has stroke symptoms, but then the symptoms completely resolve and go away. And so when you do a brain scan, like he got as part of the evaluation, everything looked normal because there was no permanent damage.
They weren't really sure why it had happened. All of the tests were coming back negative. And the conversation we had in the day hospital was that I was going to be discharged. I had started packing my bags, and the cardiologist walked in and said, "We found something." And it turns out that the TIA was related to a PFO, which is basically a hole in between the atria and my heart. And so what can happen is a blood clot can pass through that hole and create the symptoms of a stroke, or in my case, a TIA.
It's actually a common congenital abnormality. About 20% of people are born with it. For most of us, it doesn't cause any problems, but it can be a cause of stroke in some people.
The options at this point were to go on medicines, some type of blood thinner, and hope that would be sufficient to prevent anything like this from happening again. Or in addition to that, potentially doing something more definitive to close the PFO. We do have a procedure called a percutaneous PFO closure. And this would essentially involve using catheters or tubes going up from the veins in the leg up to the heart, and then deploying a special device that essentially would seal or close over that flap or the PFO.
Everything we do somehow comes back to fitness. It's become our living. Fleet Feet Sports is about helping others live a more fit life. And so to anticipate that one day down the road, Keith could experience a more devastating stroke, there was no argument. And that's where Dr. Reynolds and Dr. Gandhi really guided us to understand exactly how the process would happen, exactly how the PFO would be closed.
Dr. Reynolds became convinced that what I had was indeed a TIA and ruled out every risk factor for stroke except for the PFO. And at that point, the link was made. And I just am thankful that I had such a great advocate, because without that advocacy, I would still be walking around really at risk of another stroke or TIA. And as I've come to understand, it could be a stroke with lasting effects.
This was a situation which in fact is quite common, where you had to have collaboration between different disciplines in medicine, in this case neurology and interventional cardiology.
There's not a definitive treatment, and so you have to work with the patient and individualize their care.
So we got together, Dr. Reynolds and I, kind of looking at his situation, working together. It was felt that Keith would benefit from a PFO closure.
Dr. Gandhi had a lot of experience, and this was the option that gave me the least risk for recurrent stroke and restored me back to kind of full capability. I want to get back into life. I don't live slowly. I like to do triathlons. I want to do another Ironman triathlon. I just kind of jumped back into living the way I lived, and the way I live is to go for a run.